So thank you for joining us here today. I am so thrilled that you are here for this incredibly hot topic called To Shot or Not. My name is Jill Christensen, and I'm an employee engagement expert, best-selling author, and keynote speaker. I partner with Online Rewards and present quarterly on their webinars so that we can bring you cutting-edge and timely content, recommendations, and solutions to critical issues that are facing your organization. And if you have any questions today, please put them in the chat folder. We'll field them at the end of the formal presentation, which will last approximately 30 minutes. And then if you provide your name and mailing address, everyone here today will be receiving a copy of my book, If Not You Who, How to Crack the Code of Employee Disengagement. Now on to the show. So as America races to vaccinate as many people as possible, as quickly as possible, this issue not only touches you personally, but also professionally. Why? Because organizations are going to have to make some really tough decisions and take a stand on the COVID-19 vaccine. Questions are going to have to be answered, such as, should you mandate the vaccine in your company? If not, should you encourage employees to get vaccinated on their own? If so, what are the most effective ways to do this without acting like Big Brother? Is rewarding employees a viable option? And is any of this even legal? So today, I'm joined by two industry experts in healthcare to answer these burning questions. So Charles, please move the slide forward. So welcome Zach Lipner, the former Chief Human Resources Officer at Newark Beth Israel Medical Center, and Gaylen Evans, Director of Employee Experience and Culture at Parkland Hospital. I'm confident, and thanks to the information and perspectives that you are going to be getting today from Zach and Gaylen, that what we're about to share, you're going to leave more educated, informed, and inspired. Charles, please advance the slide. You are also going to have the information you need to make decisions about the vaccine that are in the best interests of your business, your employees, and the people that you serve. So Zach is going to kick us off by talking about whether or not employees should roll up their sleeves and the business case for promoting vaccinations. Then Gaylen is going to dive into the benefits of vaccinations. And before we get to the Q&A portion, I'll discuss strategies to encourage employees to get vaccinated, from education to communication to rewards and recognition. So Zach, take it away.
Thanks, Jill. Charles, let's put up the first slide there. So I have spent 35, 40 years working in healthcare and saw stuff that happened this year that never thought we would ever see happen. And before we even get started with today's presentation, if we would just take ourselves back a year ago when this pandemic was just beginning and we had no idea what the world was going to be like. And as difficult and as painful as this has been, where we are today is in a place that we probably couldn't have predicted either. Just need to take a second and think of the tremendous scientific accomplishment in the last year, where we have not only treated millions of people in the United States for COVID and have fortunately been successful with many of them and dealt with the horrifics of the death that came from COVID, but now the scientific advancement that is available to us in the vaccine. And that is an incredible scientific accomplishment. And everyone, whether you are in healthcare or not in healthcare, just needs to stop for a second and appreciate the hard work of all the healthcare professionals and all the scientists that went into making this vaccine available and becoming more and more available to Americans and people around the world. But one of the problems that we have is that healthcare is only so resilient. I watched nurses and doctors on the front lines of healthcare doing incredible, incredible things. Things they didn't even know they had in them to do. But I will tell you that they are only so resilient. And the emotional atmosphere in healthcare these days is fragile. And all of us, whether we work in healthcare or not, need to support our healthcare workers who are on the front lines and dove into COVID for all of the horrible things that COVID did, and then cared for the people who were sick from this disease. And we need to recognize that despite all of our efforts around social distancing and masks, that the only way out of this pandemic is going to be with the vaccine. The vaccine is the way out of this pandemic. I think we all know that. And we have to figure out a way to get there, because in order to really get out of this pandemic, we have to get to what the scientists call herd immunity. And right now, the numbers are not supporting the idea that America, or pockets of America, will be able to achieve herd immunity. Charles, hit the next slide for me. So should employees roll up their sleeves? I believe that they absolutely should. I think that employers ought to consider helping our employees to understand the value of vaccine. And we can see on this slide here that was prepared by Milliman, a large actuarial firm, that many employers are encouraging employees to get vaccines, but there is still a good number that are on the fence as to whether to encourage them or not. And then clearly we have to talk about how we're going to encourage them. Hit the next slide for me, Charles. It is about the business case for vaccination. Why do we need to do this? Because we want our employees want to feel safe. And if they've been working remotely and now we're going to ask them to come into the office, we clearly want them to feel safe in the office. And we have those employees that are vaccinated who might be saying, hey, what about the guy who sits next to me? Is he or she been vaccinated? Is he or she doing everything to protect me in the way that I am protecting him or her? So we clearly want to make for a safer workplace. All of our employees want the workplace to be safe. And that means supporting those people who have already been vaccinated and are planning to be vaccinated in the future. We want the public to feel safe in our environment. We want the public to feel safe around our employees. We all have public-facing organizations. We go to meetings. We do all kinds of ways that we want to return to normal in terms of how we carry out our business. And we can't do that if the public doesn't feel safe in our organizations and the employees don't feel safe coming there. And we all want to return to having the social nature of our organizations. I think that more than any time now, we realize how important it is to have a social organization where people are talking to each other, where people are having lunch together, going to break together, finding out about their kids. That doesn't happen in Zoom meetings. And those are things that drive engagement and drive retention in our organizations. I heard yesterday in a report, I think from Challenger, Gray and Christmas, that 50% of people expect to be looking for a new job in the next year. That is amazing. And we need to do everything we can to retain those folks in our organization. And then I'd like to talk for a minute about the social responsibility of corporations, because I think it's part of the business case also. More and more, we are hearing our organizations wanting to get involved in this subject of social responsibility. They want to align their company values with the societal values. And one of those values is access to health care and promoting wellness in our organizations and in the communities we live in. And we know that the minority communities and underprivileged communities in the United States have been hard hit by COVID, both in terms of infection rates and in terms of death. And the outcomes have not been good because of the underlying disease in these communities. I think businesses know that we need to help the communities around us with these kinds of public initiatives, and we need to support them, and helping our employees to understand vaccination and encouraging those reluctant populations to get vaccinated is part of the way we get out of this pandemic. Charles, hit the next slide for me. So the value of the decade, I believe, is safety. We've been talking about it in healthcare now for a few years. No one wants to come to the hospital and find out that we are not in a safe place. I think nobody wants to come to any work environment these days and find out that we're not in a safe place. Safety truly is the value of the decade. It is what are we going to be talking about for the next 10 years. We don't say goodbye anymore. We say be safe. We don't say sincerely yours at the end of an email. We say be safe. Safety is the value of the decade. We are going to be talking about this in the workplace more and more. And we need to add that safety value to our organizational values. It's easy. It's mom and apple pie. Who's not opposed to safety? But we want to create that culture of shared protection. How would it be if an employee who was vaccinated got a hang tag to put under his or her ID that said Pfizer, February 16, 2021. That was my date. I will not forget it because that was the date I got vaccinated. What message would we be sending to our colleagues in our organizations and to our customers that proudly displaying the fact that we are protecting them from COVID? So I leave that thought with you about this value of the decade, and how do we as an organization now turn this value of safety and this need to vaccinate our employees to create that safe workplace? How do we make that actionable in the workplace? So at this point, I'd like to turn the presentation over to Gaylen Evans from Parkland Health to talk a little bit about mandatory vaccines and our experience in healthcare as to whether or not mandating vaccines is something that we might want to consider, and she will use her experience at Parkland and all of our experiences in healthcare to talk about mandating vaccines. So Gaylen, if you're ready to go, I will go on mute and turn this over to you and let you run with it.
So thank you, Zach, and thank you all for having me to participate on this panel to discuss this very important topic. For those of you that have been in a healthcare environment, the past year has been tremendously challenging. I have to tell you that, you know, when people ask me, what do you do at the hospital? What's your job? And I told them I'm the director of employee experience and engagement, and their eyes get really big and say, that must be a pretty tough job in the middle of a pandemic. But I want to start by saying that getting the COVID-19 vaccine is a very personal choice. And it's completely understandable for anyone to have concerns about getting the vaccine. As was stated earlier, and what we will continue to discuss is education being the key to helping to minimize those concerns and really allowing time for this vaccine confidence to grow. What I often find myself, and I have observed in other colleagues and friends, is sharing their personal experience with others around their choice for getting the vaccine and having their family vaccinated. And I can tell you, for me, it was minimizing the stress of bringing it home to my 16-year-old son and seeing the worry that he would have every day with the systematic process of getting home, being in the garage, taking the scrubs off, washing my hands, and not being able to give him a hug or touch him until after I've showered. And imagine that process for months and months at a time, and I'm not even in direct care of patients. So I certainly sympathize with those that are. But that being said, I want to talk a little bit about historical vaccines that have been mandatory in the workplace. The first one that comes to mind for me is the flu vaccination, specifically in healthcare environment. And in most of those environments, the flu vaccination is mandatory. Now, you know, we have to remember that the flu vaccination is 79 years old. It was first developed in about 1942. And just to talk a little bit about the process, and it's pretty common in most healthcare systems, it is a mandatory vaccination, but there is an exception process. But I can tell you that the compliance for the flu vaccination is well into the 90% in my organization, and we have about 14,000 employees. But let's look at some statistics related to compliance percentages with the flu vaccine in healthcare. And I can tell you that the CDC, I read an article by the CDC entitled Influenza Vaccination Information for Healthcare Workers. And they definitely recommend that all healthcare workers get vaccinated annually against influenza. So when we look at 2019, 2020, flu vaccination coverage among healthcare workers was about 80%. The highest being amongst physicians, which was about 98%, nurses about 92%, and these are national averages, and pharmacists coming in third at about 90.6%. So pretty high compliance with flu vaccination. The lowest coverage we saw was amongst assistants and aides and non-clinical healthcare personnel. And you kind of see the same trend with the COVID vaccination as well, where we're really having to put a focus and be strategic about educating our EVS team members and food nutrition services team members, where we've seen lower percentages of propensity to want to take the vaccine. I want to talk a little bit about, I'll move into the benefits of vaccine for the workplace. And the first one being is preventing illness. We all know that healthcare workers are at a higher risk of exposure. And when you talk about complicating that with ethnicity and race and underlying conditions, the type of job you do, or you frontline, or you taking care of directly COVID patients, but preventing illnesses and also reducing absences within the workplace. We all know the severe nurse shortage that we've experienced during this pandemic and trying to staff and the high turnover that's nationwide that we've experienced. So minimizing our employees getting this virus and staying healthy is super important and is one of the greatest benefits of getting the vaccine. Also, it helps to prevent the spread of COVID-19 to our patients. And we talk about improving morale. And I'll tell you a story about when the vaccine landed in Dallas, and we were one of the first hospitals to receive it. We're one of the biggest safety net hospitals in the country, and we're able to store it at the temperatures that are required. But the first day that we opened up the vaccine to our employees, and I remember we have these carrying carts that has snacks on it. And so there were long lines, and I wanted to make sure that we, encouraged and made them feel this is important. This is a great day for us. And I went upstairs where the clinic is, and I turned the corner, and I can't even describe to you how many people were in line to take this vaccine. And I proceeded to go along the line with my carrying cart and just say, isn't this an exciting day for us? And how excited everybody was to get this vaccine. And then we didn't have, it was the first couple of days that we're still figuring out how not to have the long lines. But some people stood in line for quite a while to get their vaccine. And it was just very exciting to see that, and our employees were excited as well. Even now, the morale, we feel like we're getting back to some form of normalcy, where if I've had my vaccine and you've had yours, I can hug you. Can you imagine how long we've gone without being able to hug each other? And so that has been a tremendous, just a space of happiness for all of us. And I also think making the vaccine easily accessible has been really a positive for our employees as well, making it easy to get it, which helps promote getting it, throughout the organization. So those are the things that I really wanted to cover about, the benefits of getting the vaccine, and also talking a little bit about flu and the history of having a vaccine like the flu mandatory in the workplace.
Thank you so much, Zach and Gaylen. Charles, if we could go to the next slide, please. And so, while everyone is absolutely entitled to their own opinion about how their organization should manage the vaccination, what you are hearing from us, I hope, is that we believe you should not mandate the COVID-19 vaccine. Instead, you should develop a strategy that outlines how you are going to approach the issue, the action items, the owners, and also how you're going to measure success. And, a key part of that strategy is going to be promoting the vaccine and encouraging employees to get it. So as Zach spoke about earlier, we can see that 41% of organizations plan on using communications to encourage employees to get vaccinated. And so when we think about education, it's no secret that the amount of information about COVID-19 in the news media is absolutely rampant. We've got a lot of scientific evidence, but we have equally as many questions, concerns, rumors, and doubts. And for that reason, we're recommending to you that company leaders, HR, your health, environment, and safety organization partner with your internal communications folks to create a steady stream of facts. This is going to help educate your employees, which in turn is going to help people overcome any fears that they have about the virus, about the vaccine, about their health, and about their personal safety. We know that employees absolutely love Q&A documents. So a Q&A document is a great tool to use to really educate people about the facts as it relates to the pandemic and the vaccine. And then also, developing an effective communication plan is incredibly critical. So Charles, if you could move to the next slide. So when we talk about an effective communication plan, there are 7 elements of that plan. One of the most important things that you need to do is to find out how employees want to receive information. Many times in an organization, a group communicates how they want to communicate, right? So whether they are going to use a voicemail message or focus groups or Twitter or an email, they don't reach out to employees generally and ask employees how they want to be communicated with. Needless to say, your communications are going to get through to people if you use the vehicles that people most want you to use as it relates to communication. So make sure you're checking in with your employees and asking them what communication vehicles they want you to use. It's also incredibly important that you are just really straightforward, open, honest, and genuine. Please don't candy coat anything. Please don't communicate in a long-winded way or pages and pages and pages. We live in a Twitter world. Your communications will be so much more effective if they are short, filled with data and facts, and to the point. Also, we know that one way to encourage more people to vaccinate is to share employee vaccination experiences. And so you can have people posting pictures on your internal social networks, on your intranet. They can do Mythbusters in a humorous way. Because a study published in 2019 shows us that people who perceive that more of their friends and coworkers have gotten the flu shot, they then are more likely to get the flu shot themselves. So even if they didn't do it in the past, if people can see their coworkers getting in on the vaccination, it will encourage them, because social norms are important to people. It will encourage them to potentially get vaccinated. Also, it's really critical that you address your exempt employees. And so, employees who are exempt for medical reasons or religious reasons, it's really important that they don't feel any pressure or social rejection at the workplace. And so again, in all of your communications, we are wanting to steer people toward the vaccination, right? But it's not that it's mandatory. This is really about us planting seeds, if you will, that the vaccine is potentially a good thing and that we want all employees to be considering it. And, when those communications come from a trusted leader who people respect, they are more believable. So that might be your head of HR. It might be your CEO. It might be someone who's not on your senior leadership team, but tap into the person in your organization who employees really listen to and trust, because if the communications are coming from that person, they will land better on employees. Again, they will be more believable. It's also critical, once you start creating all of this education and communication, to the extent that you can house it in one place in your organization, one-stop shopping, it will be easy for your people to find. So be it on the intranet, in a Dropbox, in a place on Microsoft Teams, wherever your employees go for critical information, put all of your COVID-19 information and vaccination communications there. Make it easy for people to find this information so that they can refer back to it if necessary. And then also, it's really important that you not only educate and push content communications out to employees, we call that a one-way communication culture. And while that's good because people are getting information, it's nowhere near as effective as a two-way communication culture. And that's where you're not only educating employees and sending communications out about COVID-19 and about the vaccination, but you're also inviting employees to engage with you and the subject matter experts in your company in a dialogue, in a conversation. So maybe you hold town hall meetings. Maybe you conduct focus groups. Maybe you have a Q&A folder where people can send their questions, and then you use those questions to inform the Q&A document, right, that we recommended that you send out, because we know that people love Q&A documents. So as people are submitting questions, those are the questions that you can be answering. Because trust me when I say, if you've got one or a handful of people in your organization asking a particular question, there are many more people in your organization who have that same exact question, but they're not asking it because it's not human nature to speak up. And so to the extent that you create forums and opportunities for employees to engage with you in a dialogue, we think that's going to go a really far way in getting people to be more comfortable about the topic, more comfortable about potentially getting vaccinated. So if we can go on to the next slide, the next thing that we're going to talk about is something that's a bit interesting. And it's really about whether or not you want to consider rewarding and recognizing or incentivizing employees to get the vaccine. So as you can see, Willis Towers Watson just completed some survey results that's fascinating to me. Currently, we've got 20% of employers who are offering employees incentives to get vaccinated, and another 29% that are planning to do so or highly considering doing so. And so you're talking about, more than half of organizations that plan on using reward and recognition. And I think one of the reasons that is because we know that rewards are a truly powerful emotional tool. They have the ability to motivate people in certain ways to do certain things. And there's a term for this, and it's called the incentive theory. It emerged in the 1940s, and it proposes that people are pulled toward behaviors that lead to rewards. And, ideas for incentivizing your employees to get the vaccine are incredibly broad. So they range from not only allowing employees time off to get vaccinated, but you could also offer points or credits in a wellness, or if you have a points or credits or a catalog in your employee recognition and reward program. You can also coordinate socially distanced vaccination parties where you provide people with breakfast, lunch, refreshments to talk about the vaccine. And potentially, if you're offering the vaccine on your worksite, that's where people could be doing that. So it was fascinating to me. I live in Colorado, and I went to UC Health here to get my first vaccination a few weeks ago. My second one is tomorrow. And I went in, I got the vaccination, and then they ushered me into an auditorium where they wanted me to sit for 15 minutes to ensure that I didn't have any type of a reaction to the vaccination before I drove home. And let me tell you something, this auditorium was like a party. They had music playing from the 1980s, the Village People. They were giving out refreshments. Yes, we had masks on. Yes, we were socially distanced. But it wasn't like sitting in this somber room, where you had just got vaccinated and now you're waiting to see if you're going to have, some type of a negative reaction. It wasn't like that at all. I literally felt like I was in an environment that I hadn't been in a year. It was happy. People were smiling. There was an energy about it. And so, I thought to myself, wow, UC Health got this right? I felt incredibly safe, like Zach pointed to, but they made an event out of it. And it was a happy event, and it was a social event. And so to the extent that you can do that in your organizations, I think that is a great idea. You can also incent employees with paid time off who get the vaccine, or you can enable employees to have a more flexible working schedule for a certain period of time who are vaccinated. And so we also know, if you're thinking about money, so in this Willis Towers Watson survey, we found out that only 10% of survey respondents say they are going to offer cash or other financial incentives. So as a group, you can absolutely do that, but we're considering that you not offer money. And the reason why is this, because we don't want you to send the signal that getting the vaccine could be harmful. And so we're going to pay you to get the shot. We think a much more effective approach is for you to recognize employees who get vaccinated because they're aligned with the values in your organization of safety first. And, we know in many organizations, their rewards and recognition program is aligned around values. In many organizations, employees recognize one another based on whether or not employees are living the values of the organization. And so if safety is one of your values, perfect. And if safety isn't one of your values, as Zach said earlier, nobody pushes against safety. Everybody wants to work in a safe business environment. And so you could just pull safety as out of your back pocket and say, as an organization, we value safety. And so that will encourage employees to get the vaccine from a safety standpoint and not a cash standpoint, a monetary standpoint. And we believe that's a good thing. And so with that, we would love to get to the Q&A portion. I haven't been looking at the chat box, but I see that there is some chatting going on and potentially some questions have come through. And so Annette, if we could move to the Q&A portion, we would love to hear what's on the minds of the people on the webinar, what they're thinking, and any questions that we can answer for them so that they have clarity on what to do when they go back to their organizations.
All right, thank you so much for your presentation. The first question we have is, are there any HIPAA issues with this?
Let me see if I can kind of get my arms around that one. Encouraging people to get vaccines, there's no private health information in that. People who provide us with record of their vaccination in order to get whatever we may be rewarding them with or recognition we may be giving are voluntarily giving you that information. You need to protect it the same way you would protect any other health-related information about your employees. But this is not a privacy matter because you are not the provider of the healthcare or the provider of the vaccine. And I see that someone else asked whether if we force employees if we don't force employees to get the vaccine, can we ask them to bring proof? And I think the answer to that is sort of the same, which is we can ask them to bring whatever we want to ask them. If we're not going to make it mandatory, then the bringing of the proof is going to be voluntary by its nature, and that's what will get the recognition is the proof. I think we ought to require the proof, but I think we ought to also be proud of that proof. Earlier, I suggested hang tags to go under people's ID to show that they got the vaccine. I think that will create some peer pressure in the organization to get more folks vaccinated. So when people show us that they've been vaccinated, we ought to broadcast it to the organization, and hopefully we'll be able to say to our public-facing part of our organization, as well as our employees, we are 95% vaccinated, we are 98% vaccinated, we are 100% vaccinated, so that everyone feels safe in the workplace.
All right, thank you for answering that. The next question we have is, how can we recognize people who get vaccinated without creating discrimination against those who will not because of religious beliefs or medical impairments?
Well, let me see if I can. Let me start off by saying I'm not an attorney. So anything I say on this webinar is not construed to be legal advice. You should certainly check with counsel around any legal issues that you may feel are going on in your organization regarding vaccination. But those people who elect not to get the vaccination for religious or medical reasons are actually being protected by the discrimination laws in the United States. So can you recognize people who fall on the other side of the spectrum? You absolutely can. The question is, should you do something for those folks who truly have those religious beliefs so that they don't feel as though they can't participate in this celebration? But you can certainly reward, recognize, encourage, and do all the things without running afoul of any discrimination laws, so long as you don't require those people who have sincerely held religious beliefs or documented medical impairments from getting the vaccine. But not recognizing them is not discrimination.
So Gaylen, this is Jill. So I have a question that some of my friends have been asking me. So there are some organizations out there, and I'm not sure exactly what it is, Office Depot or Staples, that's offering to laminate your vaccination card once you've had your 2 vaccinations. And I looked at that and thought to myself, but there's a bunch of other lines on that card, and I'm thinking those lines are for the booster shot that we don't know right now, right? We might be getting that in 6 months from now, a year from now, every year from now. You know, I've heard that the vaccination card is potentially going to be your ticket to a lot of freedom in the future, right? So we already know that there are some cruise lines that you cannot sail on if you don't have a vaccination card. The airlines might say you can only board a plane if you have a vaccination card. And so is laminating your vaccination card really the smart thing to do when, again, there are healthcare providers who may need to write on it again in the future? What's your thought on that?
No, that's a great question, because I will tell you personally what I did, because at the time when I had my vaccine, it was very early on. So the talk of a booster was not as prevalent as it is today. Mm-hmm. When I received my second vaccine, I laminated my card, not even thinking, oh my goodness, I might need a booster. Now, I do know that I can go back and ask, hey, can I get another card if I have to get a booster? Of course, I have that available to me.
Because you work in healthcare.
Also, yes. And so I think it's a great question to put out there, because I quickly laminated mine, because all I could think about was, I am going to go on some tropical island on the other side of this, and I know I'm going to have to prove that I'm vaccinated, and I didn't want to pull out this card that was, not in great condition, right? And so, I think that, and again, I remind you, at the time, it was very early on when I got mine laminated, and my son, who recently got his vaccination, he's 16, of course, they just opened it up. And I tell him, I'm going to laminate this, because if I give this to you, who knows what shape it'll be in 14 days. So I think it's a good, now that we know that there's possibly a booster, again, for me, I'll just have to, I have access to my medical records, and most people have a My Chart or something where they can print out their it's no different than any other immunization record that you would have, and they'll include COVID-19, but I laminated mine.
Okay, perfect. But for people who are not in healthcare and might not be able to get that vaccination card as quickly or easily, I don't know. I think I'm going to put mine in a plastic sleeve, right?
Yes.
And then just cut around the plastic sleeve. So it is protected, but I've got the ability for people in the future, healthcare workers, to continue documenting my vaccination.
I think that's a great idea.
Let me give you another suggestion. Take a picture of it on your phone.
Yes.
Oh, great idea, Zach. Okay, so to all of our attendees, these are things that you might want to be putting in that Q&A document, right? Because they're, if they're on our minds, they're absolutely on your employees' minds. So Annette, are there other questions that are coming in?
I actually have a question for you. Could you explain the difference between rewards and incentivizing, just for clarification purposes?
So Zach, which piece of this do you want to take, the rewards or the incentivizing?
I'm an advocate for recognition. We don't recognize our employees enough. I mean, I think it is the most underutilized HR tool that is available to us. When we list all the HR tools in our tool belt, recognition is the one that we probably use to the least level of effectiveness. The reward thing, where we put the dollars out there or the stuff out there, we all wish we had bigger budgets for that and think we could do great things if they would give us bigger budgets. But the recognition is at the heart of this. So whether you want to call it incentivizing or rewarding, it's calling people out and saying, you are aligned with our values, that you are part of our organization, that we are we're in sync in terms of where we are taking this organization. We're all rowing in the same direction. That recognition is where the rubber meets the road. So do the recognition thing. The reward will fall in behind it. That's
exactly. And I think one of the ways that you incentivize people are the things that we've talked about. You incentivize people, right, to get the vaccination by educating them. You incentivize people to get the vaccination by communicating with them. You incentivize people to get the vaccination when they see their colleagues getting vaccinated, right? And when those stories are shared. And so incentivizing is the first piece of it. And you do that via education and communication. Then on the back end of it, whether or not you want to reward and recognize people, that is completely up to you. But as Zach said, reward and recognition is an incredible motivator. But I don't think it should just be, oh, get the vaccine and this is what we're going to give you. I think there's, that's like going on a first date and asking someone to marry you, right? So there's a courtship that needs to happen. And the courtship is that education and that communication. You need to really lay the foundation and lay the groundwork and give people the education and the information. Then, right, you're in a position to say, oh, and by the way, if this is a decision that you want to make personally for you in the direction of the vaccine, here's what we're offering you, right? So again, and we believe that the approach is that you want to recognize employees who get vaccinated because they're aligned with your company value of safety first. If you position it that way, then it's very fluid. It makes a lot of sense. You're not just screaming to people, bye, 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 right? You're giving them the context and laying the foundation and moving them toward that decision. Whether or not they ultimately make that personal decision is completely up to them. But we're giving you tools and resources today that we believe will help you make an effective case and move more people toward vaccination than not.
I'm going to chime in here and say that I think at some point this could be mandatory. But I also believe that we have to allow for vaccine confidence and that time, giving people time to build up their confidence. What I've observed is the more people who get it, the people who are more hesitant, they're waiting to see what's going to happen. Is your right arm going to fall off 6 months after you get this? And literally, I've heard people say that. It sounds ridiculous, but I've heard people say that, is building up that confidence. One of the things, and we had some conversations in our organization about, do we give someone on a badge something to indicate they were vaccinated versus those who have not, and we've not made a decision to do that. And I think it's there's a very fine line there between discriminating against people who, one, made a decision not to have it or can't get it for whatever reason. But what we did do, which was highly popular, is when anyone went and got the vaccine, you got a sticker that said, I got my first shot. And let me tell you, you would think a little sticker, but it just went haywire where people were taking their picture and posting it on their social media pages. And I know when my mom, 73 years old, came and got hers, I posted it on my LinkedIn page. And that was my way of trying to encourage, people her age to come in and get their shot. Look, I trust my own mother to get it. You should go out and get the shot. So I just think that, understandably, when we look at the history of vaccine in this country, there's a large population of people who really, they don't feel comfortable yet. But I think that will decrease as this vaccine matures.
So Gaylen, do you also think that will decrease because people are simply tired of not having a social life?
Absolutely.
To what extent do you think that will play in people getting vaccinated?
Quite a bit, because, I even hear people who say, hey, I want to have a get together next month, but everybody who comes has to show me their vaccine card.
Really?
Yes. I got invited to a birthday party this weekend for a 1-year-old, but you cannot come in if you have not been vaccinated. I think that's going to be an organic thing that continues to grow, which will encourage people, at the very minimum, I want to go see grandma, right? And I want to make sure you're going to have those types of self-incentives that will continue to encourage people to get that vaccine so we can get back to some sense of normalcy. I can tell you just within the walls of my organization, I'll take this 10% back to normalcy than the 0, right? Being able to go in a room and meet with people versus always being, you miss that. I'll never complain again about, oh my God, I got to go sit in this hour meeting. I'm not complaining about that again. I'll take it.
Exactly. And I truly believe there's going to be a day where if you want to go to a concert, a large sporting event, right? So, I keep thinking to myself, it's going to be interesting to see what happens from a legal standpoint, right? To the extent that people say that's a violation of my rights. So I think there's a lot more to come down the pike, to your point, that we don't really know yet. But I'm happy to hear that people wanting to get back to social also might be an incentive, right, for people to get the vaccine.
Well, Jill, look at the cruise lines.
Yes.
You know, and you have to have a vaccine to go to book the cruise, to get on a
Yes.
cruise
So
ship.
I was on vacation last week in Mexico, and I was sitting on the beach, and a cruise ship, I went by myself, and I've been vaccinated and I've had COVID. A cruise ship went by, and I said to someone who was walking by, "Is that a cruise ship?" And they said, "It's a COVID cruise," meaning if you've been vaccinated, you can get on that boat. And so they're starting to sail, right? But that card is your ticket.
Yes, it is. I wanted to make a comment too. I was very excited to hear Pfizer and the trials with the 12 to 15-year age group. I think that's going to be everything in terms of us getting these kids back to school fully. And I'll tell you, and I don't want to be the only person speaking here, but I'll give you a personal experience. We had a recent COVID exposure with my son, and I will tell you, I was dragging my feet getting his vaccine. He's 16, and they just opened it up. That week was the worst feeling. He went to dinner with 3 of his friends, and he's the only one that didn't get it. But that week waiting on those results was pretty tough, and that motivated me. Friday, you're going to get your shot, and he has had his first shot. So I think you're going to see those types of things happening that's going to encourage people to want to go get that vaccination.
Great. And Zach or Gaylen, do you have any idea how young people feel about the vaccination? Right. So I know nowadays they need tons of vaccinations just to be in school. So are young people more open to getting a vaccine, or do we not have data on that?
No, I haven't seen any data on that. You know, the problem is that there are individual populations that are vaccine resistant. New York Times talked about how we're going to see COVID deserts and COVID oases, where we have large percentage of population that are vaccinated in one community that has no COVID and other communities that do. And clearly young people are the most infected right now. So getting them vaccinated will do a lot towards stemming the pandemic. But I haven't seen anything about whether demographically young people are more vaccine pro or against.
Okay,
and
thank
Jill,
you.
I can only speak from just having a 16-year-old who plays sports, and you know, he plays soccer, and there were times when, you know, I remember the team, the whole half of the team was out because they had an exposure. And so I think you're going to see those kids being more motivated to go get their vaccine because they don't want to not be able to play. They don't want to not be able to engage in their sports. And so that's, from my lens, I see them in him and his friends wanting to get it.
Right, and that goes to the shared value here in a team, right? So workplaces are no different. We share values across the team. We don't want to let our teammates down. So if we want to have a business environment that is safe, there is a collective need for vaccination, and we ought to express that collective need as a business. We ought to recognize it as a value, and we ought to recognize those people who align their values with us. And I think that is the takeaway that we are trying to create in today's presentation, that there is a shared value here in protection, that safety is the value that folks can all wrap their arms around, and that vaccination is the only way out of this pandemic. So therefore, businesses are have as much skin in the game here as any other entity within our organization. Businesses have skin in the game here, so businesses need to do the right thing and encourage their employees to get vaccinated. It starts with education and ends with recognition. I'll leave that as my final thought of the afternoon.
Thank you so much. And I also want to thank everyone who attended today's webinar. Online Rewards has been helping U.S. companies and employees with developing behavior change programs around health and wellness for almost 20 years. So we were so pleased to be able to present this information to you. If you have any questions, please reach out to us. And also there will be a webinar replay that we'll be making available. So if there are people in your organization or friends or family who you think would find this information valuable, we encourage you to share it with them. And then also, if we get your name and your mailing address, you'll be receiving a copy of my book, If Not You Who, Cracking the Code to Employee Disengagement. And so we hope you have a wonderful day. We hope you go back and you create that vaccination strategy in your organization. Thanks again for participating.